Hi, and welcome to And So Much More. My name is Cami Smith, and I'm your host. And I am here with Dr. Betz, who is the Executive Medical Director of Psychiatric and Behavioral Health. And we are in this beautiful setting outside of Virginia Baptist. And the name of this particular building is Barker Crowley?
Barker Cowling Building.
Barker
right.
Cowling Building,
Yeah.
Forgive me. This is incredible. I mean, do you guys come out here often? It's so beautiful.
It is a very beautiful courtyard, and although in the Piedmont Psychiatric Center we don't often utilize the space, but
Gotcha.
those people that are in the residential program or in the IOP or the intensive outpatient program for those that have addiction needs, actually oftentimes will do activities and really enjoy the outdoors and learn that there's more to life than the repetitive need to get high.
Yeah, that's incredible. And there's really no better place in the spring, especially right now. It's just gorgeous. So thank you for letting us come and just experience this. We are going to be talking about mental health. It is Mental Health Month. And for the purpose of bringing awareness and hopefully understanding, this is something that has been identified through the Community Health Needs Assessment as impacting all of the areas that fall within our health system. And it is a significant impact that people are experiencing mental health crises on a regular basis. And so just wanting to make more available an understanding of what services are available, what does that look like? Visually, what does it look like? And we aren't going to go inside just because the level of protection that is in place, which is also important for you to know. As you're coming to appointments here, like your privacy is important. We put those things at such a high regard, so making sure that cameras aren't walking through the hallways. So Dr. Betz, why don't you tell me a little bit about yourself? That'll be a great place to begin.
Well, I did my psychiatric training and up at Johns Hopkins in Baltimore. I've been a part of Centra since 2001.
Oh, wow.
I'm a general and geriatric psychiatrist by training. Since about 2019, I've had the role of being the service line medical director. And in that way, we've been very focused on developing our addiction medicine service line, trying to create a whole array of care at a number of different levels of support so that we can meet the needs of the folks in the community. Everything from inpatient services, residential programs, intensive outpatient programs.
Wow.
We have outpatient clinics, and we have a number of different tools and programs that we've set up to collaborate with other parts of Centra as well, like in the emergency room or within some private practices. So we're looking to develop a comprehensive mechanism by which anybody at any time can reach out and get the support that they need, because it's a huge need.
Yes, and comprehensive is the perfect word. When I think about everything that you just mentioned, it covers so much. And when you think about someone who is in some level of crisis, how do you step into care? I mean, what would be their first step to? Because you guys you cover such a spectrum. But what would that look like for somebody who is experiencing that crisis for the first time?
Well, it depends on the multitude of things they're going through. Many times it's not just, I'm having an addiction problem with heroin or with an opiate or with cocaine. It really is co-occurring with other mental illness, whether it's depression or bipolar disorder, schizophrenia, or other life stresses, because frankly, life can be very difficult from time to time. So the way that people approach and ultimately receive care depends on those kinds of things that brought them to care to begin with. And so we try to create a system by which at any point somebody recognizes that addiction services are needed to help support somebody in their journey towards mental wellness. We have a way of trying to intervene, whether it's a very acute, very severe withdrawal syndrome that we've got to take care of on the inpatient service, or other settings in which people are still able to function but clearly identify that they've got a problem. We have outpatient services at a number of different levels of intervention so that people can feel comfortable, can maintain integrated into their life, and it doesn't disrupt their ability of doing things that are important, like going to work and being able to take care of themselves and their family. So I like to say that we're looking to try and take care of patients where they are, not just psychologically, but also physically, so that
Yes.
we can help address some of those needs. One of the things that we had been talking about a little off camera was that sometimes folks go to the emergency room because they're in a crisis. Well, they
Yes.
have the ability of starting some very powerful treatments to prevent withdrawal and help folks that are going through opiate addiction. And then we can follow them up very, very quickly in our addiction treatment center. So
Yeah.
there's a seamless transition of care. And with that, provide better support for the patients so they don't feel as if they're abandoned or that there is this lack of support between one location of care and another.
Yeah. So there is a relationship that is formed between provider and patient, similar to maybe a primary care, not in sequence, but in trust and understanding, and maybe helping you through that healing process. What role does a family member or someone in a guardianship position, what role do they play in healing as well?
I think you touch base on something very important, and that is developing a very positive relationship. Taking care of folks that have difficulties with addiction are
Hmm.
not lesser individuals. They are
Yeah.
just like you and me and everybody else. It's just that they have this particular problem or barrier in their life that they need to overcome.
Hmm.
And so we're here to support them. And it's very important for that individual to want to engage in getting care and getting support. I can't just point my finger to somebody and say, you
Yes.
need to get better. And
Yes.
so the role of a loved one, a parent, a guardian, a spouse, a sibling,
Yeah.
is to try and help encourage someone to seek some support and care. And it's a journey. Addiction treatment is not one where it's, well, gosh, using one day and then absolutely will never use again.
Yeah.
Many times there are slips and there are relapses. And those aren't points of failure, but those are points to learn from how do we do things better moving forward. And
Yes.
our system of care is able to help match what those patients need when they need them.
Yes.
Hopefully, with a lower degree of intervention over time, but sometimes we may need to have more support, and that's okay. We're here to do that, and this should be a trusted, engaged environment. We've got tremendous patient satisfaction scores. People seem to really like the level of support and care that they
Yes.
get
That's
here.
incredible.
We get some great feedback from folks. It really is not meant to be judgmental. It's not
Hmm.
meant to look down on anybody because it's not a character flaw. It's just it's a disorder. It's an illness from which
Yeah.
folks suffer from, and we want to help those.
Yes. I love how gentle that approach is. Even as you're talking about it, there are some very key life lessons, I think, that you even just described in not letting a relapse define you. Like it's a bump in the road, it doesn't end, you can continue to move forward. These are lessons that are so valuable in your everyday life, and recognizing that addiction is a part of some people's everyday life, and you cannot pinpoint them or give them a label in a way that will set them apart in a negative way. So it's a very gentle approach. I can see why your scores from patients would be very high. It's important to feel safe in those environments. Once someone has gone through your program, what does it look like to have like continued support after you're kind of out of that really unsafe zone, when you've moved into some healing? You've got some great tactics in place, you know what to do when a situation arises and you could step back into addiction. What does it look like when you move on from that?
Well, different folks sort of respond differently, but we have an opportunity where people can continue to get their ongoing care. So, in whatever way that they need that care. So, our addiction treatment center is a fully outpatient run clinic where you come for appointments, just like you
Yeah.
would with your primary care doctor. We have the Piedmont Psychiatric Center, where if you happen to have co-occurring or comorbid psychiatric illness like depression or bipolar disorder
Yeah.
or something along those lines, you can get the care there that you need to keep those illnesses well managed and supported, so that
Hmm.
you're less likely to be in a relapse with your addiction treatment needs. And so that way, there is a process by which we try and support folks even after their past that crisis or that
Yes.
momentary sense of, oh, I'm going through withdrawal and I feel very
Yes.
bad, because it is awful. And so we've got to help folks minimize that degree of distress so that they can feel empowered to take control of their addiction.
Yeah, that's incredible.
Yeah.
Well, thank you so much for taking some time to have this conversation. I do want to ask, is there anything I haven't asked about specifically that you feel would be important for our listeners to know?
I think that one of the things that we're working on is not just the spectrum of care, but we've got the entire system of Centra to be able to support folks in each of the ways that they need to be. From the top down, we have been consistently supported in the development of the care of mental illness and addiction needs in our community. And so our entire system is here to provide care, and this is just one part of that we're talking about today.
Yeah, a very focused part of it, but yes, nonetheless, a part of that overall care. And since I've been with Centra, I joined Centra just in 2021 on the marketing team, and I have just been so blown away by the level of care with each provider I've had the opportunity to sit down with, and also to see the intersects that you talked about, because there are so many ways that our health and our wellness intersects with different areas, and our mind is so important to make sure that that is incorporated into healing and into care. So thank you for going a little bit deeper with us to uncover. Thank you so much for your time. And thank you all for joining us on And So Much More.